So let's get a little more specific in terms of approaches to ethics. The first approach is going to be virtue ethics. So think about what you would envision to be a good clinician, a good physician, a good nurse. What are the qualities of character that dispose that person to do the right thing for their patient? Just in your own mind, think about what those qualities or traits would be. And when we're thinking about virtue theory, we're going to focus on the kind of person the moral agent ought to be. So what are the actions that a virtuous clinician would perform? And generally in virtue, we're thinking about what it is to be excellent. So the excellence of character and the motivation of that moral agent to do the right thing. Those are going to be the important things, rather than thinking about, am I adhering to a rule? Am I, thinking about the consequence of my action? Is what is my character in performing this action? Am I doing it in a virtuous way? And the other key element of virtue theory is that the more you do the right thing, the easier it becomes. So you develop your character over time. Each experience you have with a patient, if you do it the right way, in the right motivation, and really try to adhere to these virtues, that habit of character is going to be built up over time. So over the lifespan of a career, you're going to know how to perform an action because it's going to be part of your excellence in virtue. And another important element in virtue theory is the concept of doctrine of the mean. You don't want to have too much or too little. Those that are familiar with the fairy tale Goldilocks, not too much, not too little, but just right. So in virtue theory, you don't want to have too much or too little. Think about courage. This is a virtue that a lot of cultures, would say is an important element. If you're rash, if you just go in guns blazing, without thinking about the consequences, that's too much courage. If you're timid and fearful and don't know what to do, that's also not going to be right. You have to have the doctrine of the mean, the just right amount of courage, so that you're not either too rash or too timid, but you're going to be courageous in terms of upholding a value that you see as important in performing an action. And then the other way that more recent philosophers have thought about virtue theory is this idea of what is the aim of your activity? What is the aim of your practice? So in medicine, our aim is the healing action, taking care of sick people, helping people with their illness and their vulnerability. So you fulfill your role and you are virtuous in fulfilling your role when you achieve that aim, when you actually do heal the person, make them whole again in the midst of their illness. So what are the virtues in medicine? What are the traits that we think are going to be important in terms of being a clinician, whether it's being a good physician, a good nurse, a good physical therapist, a good social worker? What are the things that are going to be important, those habits of character that really speak to being virtuous? Here's my top 10 list. You might have a similar list if you've been thinking about this. Here are the things that I think are important to being virtuous in medicine. We first of all have to have technical competence. So all of our training that's gone into, whether we go through medical school or nursing school, other health professional schools, we have to learn the craft of our practice. We have to have technical competence. The surgeon, needs to learn how to perform surgery. So that's a basis. We have to apply that knowledge and that skill to then taking care of patients. The next is going to be intellectual honesty, which also means humility. So we get all this great knowledge. We learn a lot. We know much more than the layperson does in terms of medicine and nursing and so on. But we also have to have the intellectual honesty to say there are things we don't know. And that creates a need for lifelong learning. So you learn a lot in medical school, but as a physician, and even I as a physician, need to think about things. I see a new dilemma, a new clinical problem solving. I need to go back to the books and say, I don't know enough about this. And I have to be honest with patients. If they ask me questions and I don't know the answer, I have to have the humility to say, I don't know, but I'm going to find the answer for you. The next virtue I see as important is benevolence. At its core, it's just love, kindness towards another person, a sense of humanity towards the suffering of another person. So being benevolent is what's going to motivate us to want to take care of them. That also follows with compassion. So to experience with, to suffer with the patient. So we might have the empathy to see what they're going through and have an emotional reaction to that, but that then compels us to act compassionately toward them. That's going to be a virtue in medicine. There's going to be imperturbability, what I might call equanimity or equanimitas. This idea of, you're going to feel things, you're going to experience things with patients, you're going to have your own emotions, but you also have to have imperturbability. It's not distance, not emotional distance. It's being able to be in the moment with the patient in their suffering and then move to action to help them. Think of like a lighthouse. The waves are crashing, below, but the lighthouse stands firm. It's shining the light so that there aren't shipwrecks. That idea of imperturbability. We've talked a little bit about courage already. This idea of, do you have the courage to talk about hard things? Do you have the ability to, break bad news to a patient? Know that it's going to cause emotional distress in them, but that it's important that you do. Do you have the courage to do so? Or you're a trauma surgeon and, things are in crisis. Patients being rushed in, have the courage to then, do what needs to be done to help them. Self-effacement. Do you have the ability to be there for the other person? Now, this has been challenging, especially in times of pandemic, where we do have to pay attention to our own well-being. But there also has to be this idea of you're putting yourself out there for the other person. So there is some giving of yourself while you're also paying attention to your own well-being, but also being there for the patient. Truthfulness. So honesty. So when it's a medical error, when it's hard news that you have to share, being truthful in that. It's not, again, this doctrine of the mean. It's not, giving everything in terms of all the information, but knowing the right balance, the mean amount of knowledge that needs to be conveyed and being truthful in doing so. One of the most important virtues that I see, especially since medicine is practical, medical ethics is a practical discipline, is the idea of prudence or practical wisdom. This idea of now you have to integrate all of these other virtues and know for this particular case, for this particular patient, how am I going to prudently act? What is the practical wisdom that I've learned through all my experience in my training, in my career, to now take care of this patient? And lastly, you need to think about integrity. So what kind of person are you? Are you able to integrate all of these other virtues in terms of your actions? Do your core values, who you think you should be as a person, are you fulfilling those in your actions? That is what it would mean to have integrity. Your whole being has this wholeness, the ability to, take all these virtues, integrate them, and then be there for the patient. The second approach to medical ethics is going to be ethical principles. Let's first go back to a little bit of a core ethics or philosophy and think about two approaches to principlism. First is something called Deontology, which is duty-based ethics. And this is the idea that the moral agent, the person performing actions, has rationality, and they use their reasoning ability to figure out what to do, how they're going to perform. And that is based on fulfilling duties. What are your obligations in a particular case, and are you fulfilling your obligations? So the idea here is that the right action is based on following rules. That's what deontology is. The other main approach to principlism is something called utilitarianism. You may have heard of that before, or otherwise called consequentialism. So what are the consequences of the action? And in this philosophy, this philosophic approach, the idea is you want to produce maximal balance of the good consequences over the bad consequences. So each action is going to have a mix of good and bad, but at the end of the day, you want to make sure that you do more good than harm. And in this case, the right action is based on maximizing net utility. Utility is just another term for benefit. So we want to benefit our patient. You take a patient to surgery, there's going to be some harm involved. You're going to cause some pain from an incision and so on, and they have to recuperate from that. But is there a net benefit? Are they going to get better and get healed of their illness? So let's apply these ideas of principlism to biomedical ethics. And the way we usually think about that is 4 main principles. The first is respect for autonomy or respect for persons. And we're going to get into the ideas of both the idea of respect, but also the idea of autonomy. So we'll focus on that. Next is non-maleficence, doing no harm. So maleficence just means harm and not harming the person. Beneficence, doing good, actually achieving benefit. So again, that's thinking about the consequences of our actions. So on the one hand, we're not harming them with non-maleficence. On the other, we're benefiting them with beneficence. And then lastly, justice. So thinking about healthcare resources, for instance, and there are going to be various ways of thinking about justice, but it's about fairness. It's how do we distribute resources in a fair and just way.